This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to another segment of Focus on Health. I'm Ted Stefaniak. Today we're in the Rehabilitation Department of Aurora Medical Center here in Oshkosh. Now this is where trained therapists spend their time helping you rehab from various injuries or illness. But there's a lot more to therapy than you might think. In fact, depending on your illness or injury, you might have to see a specific type of therapist. Joining us now are a couple of therapists. We start with Kim Berndt. She's an occupational therapist, and Lori McGinnis is a physical therapist. And Kim, let's start with you. Occupational therapy. A lot of people think right off the bat that's somehow work-related, but that's not always necessarily the case, is it?
No. Usually what occupational therapy means is it deals with the jobs that we do every day. Things like bathing, dressing, being able to cook for yourself, clean up, those sort of everyday tasks, and we call those occupations. So an occupational therapist then works with people to help them to be able to achieve those things and to accomplish those things, and all of the details involved with that.
And I imagine there's a lot of training that goes into preparing someone like yourself for occupational therapy.
Yeah, occupational therapists need a master's level education, and we focus a lot on kinesiology and study of the muscles and the bone structure. We work primarily with treatment from the shoulder through the fingers, so everything in the hand, wrist, elbow, and so forth. All right.
And Lori, you're a physical therapist. Now, how does that differ from what Kim's doing?
Well, physical therapy does involve a lot of things as well. I think, in the inpatient setting, physical therapy deals more with people being able to get out of bed, being able to walk, get up and down steps, so they're able to go home and function mobility-wise strong enough. From the outpatient side, the spine is a big way that physical therapy is different than occupational therapy. We deal with the neck, the upper back, the back in general, lower extremities, ankles, knees, hips. Physical therapy even deals with vestibular things such as dizziness, people that have dizziness from positions of their head, looking down, looking up. So, physical therapy, balance also. But if you're looking at the difference, when the lower extremities and the spine, we're looking more to change those deficits.
In occupational therapy and physical therapy, is that pretty much all handled in this area of the hospital?
Yeah, right here. Of course, we do have other sites, but right here in this department is where we have physical and occupational therapy. We do also have speech therapy and massage therapy here at the hospital.
Okay. Kim, how many therapists do you have on staff here?
Within this clinic here and also within our satellite clinics, we have 16 physical therapists and 2 physical therapy assistants. And then we also have, I believe, 6 occupational therapists and 2 certified occupational therapy assistants.
And that's a lot of therapists. I imagine a lot of combined years of experience as well.
I think if you add it all up, it comes to something like 260 years of experience. So there's a lot of different backgrounds that people have come from, a lot of knowledge base that we have here. So we can treat pretty much anything because at least one of us has seen it somewhere.
Now, Lori, the people at home might be looking at this segment and saying, you know what, I would like to go see a therapist. What's the proper way to get in to see you guys? Do you have to get a doctor's referral to get in here?
Yes. To get in to see us, physical therapy or occupational therapy, you definitely need a doctor's order. It can be a physician, a nurse practitioner, or a physician assistant.
And you touched upon a little bit about some of the other specialty programs you have here. Can you talk a little bit more about some of the specialty therapy sessions you have here?
Sure. On the occupational therapy side, we have our lymphedema program. We also have 2 therapists that specialize in the hands, and they actually have a certification. They're certified hand therapists. On the physical therapy side, we have a wide range of specialty services, including vestibular rehab, an osteoporosis program. We have a women's health program, Also a falls risk prevention program that deals a lot with elderly with balance problems. We also have therapists that treat the spine, work injuries, sports injuries, and even TMJ.
Now we're taping this interview in the dog days of summer, and you also have an aquatics therapy session. Can you tell us a little bit more about that?
Yeah, we do have a pool where we do aquatic therapy. It's different than your ordinary pool, where you can change the resistance of the water for strengthening or balance. And it does have steps, different heights of steps in the water that can be used also for strengthening or sitting on the step and doing various exercises. But this facility here at the hospital is the only facility that has the aquatic program.
Okay. And Kim, this is a tremendous facility here at Aurora Medical Center, but there are other places Aurora has set up around the community to help out with therapy, don't they?
We have physical therapy programs located at Doctor's Court, which is over on the north side of town. We also have physical therapy services located in Neenah and then also at Watoma, and they all operate out of this same system here. You get physical therapy services at all of these places, but then the occupational therapy, speech therapy, massage therapy is all here at this site.
Okay. Well, that'll do it for us today. Thank you for inviting us in here, and thank you very much. Have a great day.
Thanks.
Thank you.
As you heard, there are many different options offered at Aurora Medical Center to help you rehab from an injury or illness. Now, for more information on a rehab program that's right for you, please call 920-456-6000. I'm Ted Stefaniak. We'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.